Hello, my name is Kyle Sebastian, and I am the Higher Education Programming Coordinator at the Jed Foundation. For those of you who are unfamiliar with the Jed Foundation, Jed is a nonprofit that protects emotional health and prevents suicide for our nation's teens and young adults. Through Jed Campus, our signature program for institutions of higher education, we partner with over 300 colleges and universities across the United States to guide schools in a 4-year collaborative process of comprehensive systems, program, and policy development that builds upon existing student mental health, substance use, and suicide prevention efforts on campus. Colleen, next slide, please. For our webinar this Wednesday afternoon, I'm very pleased to welcome the following panelists: Dr. Nancy Roy, Chief Clinical Officer and my colleague at the Jed Foundation; Colleen Hunter, Director of Student Support Programs at Morneau Shepell; Dr. Ivan Steenstra, Manager of Research and Analytics at Morneau Shepell; and Dina Nunziato, Director of Counseling and Psychological Services at Sarah Lawrence College. Should you want to learn more about any of their backgrounds or get in touch with us, contact information will be shared on the final slide of today's webinar. Before we move on to our agenda, I want to share some housekeeping items. So first, if you need closed captioning at any point during today's presentation, please click the link that was provided in the chat message as you logged on to GoToWebinar. This will open another window in your browser for you to follow along with a live transcription of today's presentation. Second, if at any point during the webinar you have a question for our presenters, please type it into the question box on your GoToWebinar dashboard, and we will answer it during our Q&A session at the end of today's presentation. Finally, today's webinar will be recorded for all those who could not attend this live session, and the video recording, slides, and transcript from the closed captioner will be sent to all registrants by tomorrow via email. And as always, a recording of this presentation will be accessible via Jed's Online Mental Health Resource Center. Colleen, next slide, please. So today, we are going to begin with brief overviews of Jed Campus and the MySSP Student Support Program by Morneau Shepell. We're then going to briefly share information about our study on international student mental health. How does technology play a role with increasing help-seeking behaviors and access to care for international students? And first of all, what are the barriers to care and how can they be addressed? From there, Dina is going to share campus perspectives from Sarah Lawrence College on supporting the mental health of international students and all students on campus as a partner of both Jed Campus and MySSP. And then finally, we're going to close with a discussion with audience feedback on how current events of our pandemic, xenophobia, and changing policies around international student visas are impacting the work to support the well-being of international students. And again, we're going to be closing with an audience Q&A. So please, please, please type in your questions. We really look forward to hearing from you. And with all of that out of the way, I want to thank Nancy, Colleen, Ivan, and Dina for being here with us today. And I'm going to go ahead and pass things off, starting with Nancy now to describe our work with the Jed Foundation.
Thank you, Kyle, and thank you everyone for joining. I just tell you a little bit about the Jed Foundation in this and the next slide. So the Jed Foundation is a nonprofit, really whose mission is to equip teens and young adults to navigate mental health challenges. We know that young adulthood and late teenage years are particularly challenging for many, and so we are hoping through our work to work with systems that support them and students themselves to be emotionally prepared for adulthood. We work extensively with high schools and colleges in a comprehensive program that I'll describe in a minute called our Jed Campus Program that Kyle just referred to look at their systems, programs, policies, campaigns, things of that nature to promote emotional well-being among their students and create a caring and compassionate campus. We work with communities to support emotional well-being of teens and young adults. And our goal is to have mental health really be recognized as part of general health and wellness and not a separate sort of entity that sometimes still is associated with shame and secrecy. Next. So this is our comprehensive approach. Actually, this approach is, to my knowledge, the only evidence-based approach that we have for supporting emotional well-being among teens and young adults. It actually was originated by the Air Force about 20 years ago. And when they developed the approach, they demonstrated very significant and strong evidence in not only suicide reduction, which is what their goal was, but also sort of anecdotally, they learned a decrease in domestic violence and substance misuse. So we took that model and adopted it for work and adapted it for work with colleges and now high schools. And as you see, there are 7 domains to the model: developing life skills, promoting social connectedness, identifying students at risk, increasing help seeking, providing direct service, following crisis management. What are your crisis management policies and procedures? And looking at restricting access to lethal means, so means restriction. So our approach, we really believe, you can only have a comprehensive approach if you combine all of these domains and look at each one of these areas on your campus or in your school. So as Kyle mentioned, and you could go to the next slide if you want, our Jed Campus program is really our signature program where we work with schools over 4 years to do assessments, both directly of their students and of their policies, programs, and systems, looking at each of those domains. What are the things they have in place to address those domains? Where are their gaps? And then work with a multidisciplinary team to address those gaps, develop a strategic plan, and consult with them on implementation strategies over time. And then again, at the beginning of year 4, we reassess both the students and where they are in their awareness of awarenesses, behaviors, and attitudes on mental health. And so that, in a nutshell, we assess at time 1 the policies, program, and systems and where the students are on those issues. And then at time 2, we reassess, because we really want to look at, as we're affecting systems change over time through a school's work with us in Jed Campus, we then want to be able to look at what is the impact of that systems change on student outcomes. And that's where the student survey data is especially helpful to have. We look at them before any change was affected and then afterwards, and hopefully we're seeing significant strides in their awareness, attitudes, and behaviors around mental health as well. So in a nutshell, that's me, and I'm not sure who comes next. So it's on to you, Colleen.
Thanks a lot, Nancy. So I thought, since we're talking about this study that was a collaboration of Morneau Shepell and the Jed Foundation, that it would be helpful to give folks an overview of MySSP, our student support program, and sort of what drove us to launch this program in the first place. So back in 2015, we launched this program because we were seeing international student challenges around mental health, and just hearing that from a lot of institutions who were seeing an increase in international students being hospitalized and healthcare claims, but also in withdrawals and medical leaves of absence. So what we know about international students, and I'm sure this isn't new to anyone, is that there is a 2.5 times higher personal stigma compared to domestic students. And those reasons for that are really around culture, academic, language, and social concerns or issues. So with that, the program that we developed and launched in 2015 was really in collaboration with a number of higher education institutions, and really trying to pull from the network that we already had in place at Morneau Shepell, being in business for over 50 years and really being a leader in international counseling and support for employees and families for over 45 years. So the goal with MySSP for international students back then, and it continues today, is really to utilize our network of clinicians across the globe and in over 160 countries, and also the strong language capabilities that we have. So we've got clinicians that speak over 3,500 foreign languages, as well as ASL providers in addition. So the goal is really to meet those students where they are with language and cultural challenges, and really kind of provide resources for some of the challenges that they are facing. So with that, just a kind of intro into MySSP here. The service is available 24/7. 365 to students. It is available by phone, by chat or text, or by video. We offer in-the-moment, real-time, and crisis support, as well as ongoing support with a dedicated clinician. And as I mentioned before, the goal here is language and cultural matching. So, allowing for a student to be able to reach out to us in their language and get support in the moment in their language. And with that, we support English, Spanish, French, Mandarin, and Cantonese by phone, and by chat, it would be simplified Chinese. But students can reach out for an ongoing appointment and request a clinician who speaks Portuguese or who speaks Urdu or Hindi or whatever the case may be. But the other nice piece about the culture matching is that you can have a student who identifies as queer and wants to connect with a clinician who also identifies as queer, or who has a specialty in supporting LGBTQ students. So we'll take a look at the app in a moment. I just want to give you a background on what's available. So just so that you can see into what the experience would be for the student, when a student selects one of these languages as their primary language, all of the content in the app and on our website is available in that language. So that's everything from content they're browsing to videos that they're watching, to the experience of actually clicking through to call a clinician or to chat with a clinician and get support in the moment. And I wanted to show you a demo of kind of what that user experience looks like. So here we can see English and simplified Chinese side by side. So, they really do have that experience in language, and there is kind of that cultural match with that language component as well. So a few stats that are worth sharing, and Nancy kind of alluded to some of the pre and post surveys that they do with their students, and they were kind enough to share that with us earlier on in our study, and so we've kind of adopted this as well. But basically, we asked a couple of pre-questions, and what we find is that a lot of users who are working with MySSP have not reached out to other methods on campus for support. So not reaching out to coaches or academic or career advisors, or not reaching out to faculty or staff. They're not reaching out to peers. So that's 84% of students who are using MySSP have not used other services on campus. And of that 84%, 59% of those students have actually never used Campus Counseling Center or the Campus Wellness Center. So we are really reaching kind of a different demographic. The other thing that's kind of worth chatting about is that 75% of the students on average who are using the service are using it through chat. And that's all students, international and domestic, but you'll see in a moment that seems to be the preference for international students specifically. Another thing is during COVID, I think since end of January, February, we saw a major increase, a spike in utilization because we did start supporting the international students before the pandemic really hit here in the States, because their families were dealing with it, months in advance of it really coming to the U.S. And the shift there was students really wanting to request support from a dedicated clinician and to be able to work with that clinician in an ongoing capacity. So just to kind of, I guess, wrap up what the program is, not just for the student experience, but also for the institutional partnership, we really want to work with you as a partner. This isn't a flip the switch kind of solution. We integrate with your campus crisis protocols. We integrate with CAPS goals. We can also integrate with step care if that's something that you're utilizing. You will have access on campus to student case data records where a student gives us consent, and also engagement reports, so just looking at the full picture of how your students are getting mental health support through MySSP. We do provide training for students and for faculty and staff to ensure that there's awareness of the program and education on how to use it. We refer students back to campus resources, but also out to community resources. So this is particularly helpful for those international students who are kind of stuck, if you will, in their home country, or even folks who are out of state and stuck in other places in the country off campus. We do include faculty and staff clinical consultations. So if you've got a faculty member who's working with a student and understands that there's clearly some sort of a shift, they can call MySSP and get some advice anytime about how to support that student. So that can be helpful to what the Counseling Center already does for your colleagues. We do offer on-demand content in our app and on our website, and that's added anywhere from 7 to 10 times per month. But the goal of it isn't just to inundate the the app with content that's relevant, it's also to be able to create campaigns and market around that content so that we're increasing student awareness of mental health needs and resources, but also encouraging them to reach out for any reason. We added health assessments and virtual fitness in the app in light of the pandemic and the challenges that students shared that they were having with us. And the other thing that's really, I think, special about the program is to have a dedicated client success manager and be able to meet with that person on a regular basis for touch points. And the nice thing that's unique about MySSP, I think, is our client success managers are actually clinicians themselves, so they really understand the plight of the students and the challenges that you all are facing. The last thing that I just wanted to share here is sort of the breakdown of different services that are available. So we have 3 different levels of support. We have 24/7 crisis phone support, and that's includes a lot of the things that we talked about, but I did want to highlight community resources as I touched on that briefly. This allows us to refer your students out to community off-campus specialists like psychiatry or alcohol and other drugs, eating disorders, etc. Essential, MySSP Essential allows for that phone support, but also the element of real-time and crisis phone support. You also have the ability to brand the app so that it has your school's colors and logos. And then Total Care allows for the ability for students to have that ongoing support and to do monitored referrals, really kind of connecting over clinical notes about your students where there is consent. Something that's really special in light of the study and the partnership that we have just done with Jed, there is 15% savings for Jed campuses. So I invite you to inquire about that should you like. So I'm going to pass it over to Nancy, who's going to just talk a little bit about the background of the International Student Support Study, and then she'll pass it over to my colleague, Ivan.
Thanks, Colleen. So as Colleen mentioned, the specific and unique challenges of international students in terms of accessing mental health care or support. Certainly in my own experience on college campuses before I came to Jed, and then now with all of the colleges and universities we work with across the country, we continue to hear, the same story that Colleen just talked about, and that is that, by and large, international students are far less likely to access the traditional services on campus for mental health support for the reasons that Colleen cited, a lot of cultural issues, language barriers, etc. And so as we do in our Jed Campus program with the schools that we work with, we look for partners, other resources out there when we know that there's a particular gap or challenge that we vet and that we point schools to take a look at and see if it might be something that would be of benefit to your campus. And so then when we came across Morneau Shepell, actually they approached us and talked to us about their program, we immediately thought that it could be quite beneficial to many of our colleges and universities. And so we decided to do a study with several of our Jed Campus schools who agreed to participate in a pilot program to really look at the data on usage, on efficacy, on the kinds of experiences the students had with the program. And so the study was really aimed at looking at how our international students here at home in the US would use technology to access the support that they need. But I mean, there's so many apps out there that students can use to access mental health support. The uniqueness of the Morneau Shepell program is, of course, that it is aimed to break through some of those barriers, the language barriers, the cultural barriers, etc. So it wasn't sort of your everyday app. It was an app specifically targeted to address the challenges that international students face by connecting them with someone from their country and who understands their culture and speaks their language. My own hypothesis was that certainly that was going to that would be the determining factor as to why an international student might sign up for this program. So that was the impetus for the study. And now
Thanks,
I will
Nancy.
pass to Ivan.
Okay. Okay, so next slide. Oh yeah. So so my name is Ivan Stienstra. I'm a manager of research of analytics at Morneau Shepell, and so we were asked to look at the number of outcomes. So we're looking at the what's quite common, the normal programs of usage and the reason for use. We look into program satisfaction and but also into some more longitudinal outcomes. And as we went along in the more quantitative focused evaluation, we decided that to get some in-depth background, we also did some stories to get a little bit of in-depth knowledge on the program. So next slide, please. Can you guys hear me or? Okay.
Yeah,
Okay.
did the slide not advance?
Okay, yeah, I had some issues because apparently Morneau Shepell doesn't like go to webinar. So, okay, so what we find in user demographics is that as it's quite common in our kind of intervention is that most users are actually female. We found that most of our clients were in their first year of studies, which isn't very surprising. There was a little bit of a blip of users that were actually in the program for longer and that were like in the 5+ years category. Next slide, please. So we were very interested in to see whether the non-office based approach was actually getting us some added value, and so we looked at the time of service access, and we clearly found that 36% could have used office hours, but actually 64% used non-office hours. So that's either on a weekend or after weekday office hours. So I think that's a big benefit of using the modalities that we offer. If you look at the issues that students present with, most present with stress, which is not uncommon. Some present with depression, and there's some academic issues. If you then focus more on the mental health issues that we address, it's again mainly stress followed by depression and anxiety. Next slide, please. If we look at the pre and the post intervention survey results, so we ask 3 simple questions before start of the intervention and then at the end of the intervention, and we find that there are significant results in the concern about the presenting issue. We don't find those significant results in the question that we thought would be very important, the ability to complete schoolwork and attend classes and the ability to stay in school. But we also found that actually people don't really present those issues to be a big concern when they actually go into the intervention. So it doesn't seem to be a huge issue to start with, and that's why we then don't find any significant changes over time. But their general concern about the presenting issue, because it has to be a general question, because we're addressing multiple, sometimes quite different issues. We find this statistically significant and a clinical relevant difference over time there. Next slide, please. If you look at the number of sessions that people have, so the majority actually only has 1 session. So 43.5% has 1 session. Then there's a few that have a few more sessions, and then there's a little bit of a blip that actually has more than 10 sessions. I looked at it at this determinant as in a regression analysis to see if it actually predicted improved outcomes. And it wasn't associated with improved outcomes. So it's not that those people that are in the program longer actually have better outcomes than those that actually only have the 1 session in our program. So some people just are really helped with 1 session, and some people just need a few more. Next slide, please. So we asked the question after the intervention. So if this intervention would not have been available in English, would you have used it, and would you not have used it? And 71% agreed that if it wasn't the kind of program that we offered, then they would probably not have used it. So language does matter, but it's also very much the cultural. We know people's culture, because sometimes they actually, even though we speak the language, they still decide that they're going to have the session in English, but they recognize that that we know where they're from and what their culture is like. Next slide, please. So we also did a leadership survey, and we asked them, so what are the contributing factors for investment in international student mental health support services? 80% said that there was a growing demand for it. 68% said that they needed support in multiple languages, so because that's something that's hard to offer when you have your own clinical services on campus. So 56% said that they actually had experienced limited campus resources and long wait times externally, and they really needed that 24/7 crisis triage support. And 44% of the respondents said that they needed multiple modalities, and that's something that we offer in our program. Other factors is that some students actually don't have access to the main campus counseling centers, and especially in times of COVID, of course, that's pretty clear now that it's having an online component is clearly necessary. So our findings overall is that factors that make international students vulnerable are cultural disparity on campus, language barriers, and reduced social support by just not being in your home country. So barriers to seeking help is in some cultures there's a higher cultural stigma. There's a language barrier, and there's often just a lack of time. So we had primarily first and second year students, and then we had that blip, which seemed to indicate that there were quite a few graduate students that were also using our services. So utilization was more episodic versus chronic ongoing cases. People got in touch with us when they needed it, and they didn't start long counseling sessions. It was really a one-off often, where they also reported that they thought that was a big bonus of our program, that they could just tap into our resources whenever they needed it. So 64% accessed our services outside of office hours. And it's actually bi-directional, because what we also found is that those people that we got into our intervention actually got more aware of the student mental health resources that were available at the institution, because that's something we asked them before and after too. So then it's up to the next the next speaker. The quote. Yeah, the quote went a bit. You can skip it if you want, really. So we asked some questions. We did a more qualitative approach too, and one quote was that there was a Chinese student who was reluctant to see a therapist. He liked that if he panicked, he could just text the counselor to MySSP and get support even late or at night. So it's really, or just before an exam, or the evening before an exam, they just got on their chat and really got the reassurance that they were going to be okay. Okay.
Thanks, Ivan.
Okay.
So next we're going to pass it over to Dina to share a little bit about her experience both with Jed Campus and with MySSP as it pertains to international students and domestic students.
So thank you. So like Colleen mentioned, I am the Director of Counseling and Psychological Services at Sarah Lawrence College, and we have had the good fortune of being both a Jed campus as well as a partner with MySSP now for well over a year, and we're thrilled. We're thrilled with both. I really am going to focus on our engagement with MySSP today, but let me also tell you, if you're not already a Jed campus, would definitely encourage you all to contact Jed and find out what they do have to offer, because their support is amazing. So in terms of MySSP, want to just highlight what Ivan was talking about in terms of the leadership survey and the findings, which absolutely has been consistent with our experience at Sarah Lawrence College. What you'll see on this slide is a brief blurb about how we explain the program. But let me back up a second and let you know that we really did reach out to MySSP probably going on about 2 years ago now, in large part because of all of those items that you saw in Ivan's leadership survey slide. We are a highly utilized college counseling center. We interface with about close to 40% of our student body. So we are highly, highly utilized. In general, we have a very psychologically aware population, but I will say that our international students are a difficult student group to reach. And it's not for lack of trying. We actually have, we're actually a fairly well-resourced for our size counseling center. We have a number of clinicians who have international backgrounds and have worked in the international student realm for quite some time. We do our own international student orientations. We reach out directly to them. And even with all that, we've had difficulty reaching our international students. So that was very much part of the reason for going to Morneau Shepell. I will also say that while I'm going to try to stay focused on international students and how MySSP supports international students, we use MySSP for our entire student body, our undergraduates and our graduates, and you can read, I think it's the very first sentence there. We offer MySSP to all enrolled undergraduate and graduate students. The rollout of that was very important, so maybe just to highlight that, if you are thinking about bringing MySSP onto your campus, it is important to think through your rollout and how you're going to do that and how you're going to communicate about this new program. We were very fortunate with MySSP's help to get buy-in from our campus leaders. So from our president and her senior team, they really felt convinced that MySSP was worth the investment. And in fact, they did make the investment for the entire student body so that our entire student body has access to MySSP. We actually don't charge for it. So it's something that we do charge a health fee as part of our, class of fees that we charge to our students, and we offer MySSP to all of our students. One of the things I just want to highlight about that is we actually happen to be an institution that requires all students to have a health insurance before they come to school. But even with that, and I know I'm probably preaching to the choir here, even with that, coverage for mental health, really all coverage, but I'm in the realm of mental health, coverage for mental health services can be all over the map. And we frequently run into students that have $5,000 deductibles. And in my mind, that's really not having mental health coverage, right? So the college picked up the cost of my student support program, which again, just as a little plug to MySSP, I think your costs are very reasonable. So the college picked up the cost and we make it available to all of our students. I'm fairly traditional. My training has been traditional. I'm kind of old. So I was not like gung-ho about let's bring on an app. I was actually really pretty skeptical. One thing I do want to highlight though is although MySSP is accessed through an app, we actually talk about it more as the app being a portal to accessing live trained clinicians, which I think is really important because our students are not talking to a chatbot, and nothing against chatbots, but again, I'm old, I'm a little conservative. I actually think that talking to a live trained clinician is preferable. So your students are talking to a live trained clinician. We had to sort of make that very, very clear, and I think our students really appreciate that. One of the other things that I was, I'm not sure skeptical is the right word, but concerned about is we're a small campus, and our, I feel like we have, knock wood, a pretty good handle on what happens on our campus. I really wanted to make sure that we could fold MySSP into our on-call services, that they knew our protocols, that they knew our processes, and they were actually really wonderful. about that. So just to let you know, and I wrote it down because what do you call them? Our campus success manager? Is that what you call them, Colleen? Anyway,
Yeah.
we know her as Sherry, but she's phenomenal, and she has worked really hand in glove with us to make sure that the MySSP clinicians know all of our protocols, so that, like Ivan mentioned, not surprisingly, many of the phone calls that our students make or the chats that our students make happen after hours. So we need to make sure that the clinician on the other end of the line knows our after hours protocol. And in fact, they do. And, you know, for good or for bad, we've had several instances over the last year where a student indicated that they were in crisis, and the MySSP clinician was able to follow our protocols. And we obviously made our after hours people also aware of the protocols, and it worked seamlessly. And so it's definitely possible. And again, we sort of think about MySSP as a wraparound care and wraparound service. It augments what we do. It doesn't replace what we do in any way, but it certainly augments and supports what we do. What else did I want to tell you all? In terms of our international students, I think that the language piece is very, very important. We've had very good usage from our international students with MySSP, and I think the language is important. I think maybe even more important than the language is the implied cultural understanding, because I think that when you have someone who speaks Mandarin, there's an implication, and I think it's a valid one, that there's an understanding of the culture that these students are coming from. And it is different. And I don't want to lump all of our international students into one basket, right? I don't think that's a fair or wise thing to do, but we have students from China, we have students from India, we have students from South America, and they all come, and even depending on, the region of the world, they don't necessarily come. They're not, I don't want to lump them all together either. But they do come with different prejudices maybe, or predispositions around counseling and what that is. And I think that even for some of our international students, they don't even necessarily want to walk in our doors. So the fact that they can do this from either their bedroom or from another private place feels sort of helps them maintain that sense of confidentiality even more so. Trying to think what else I want to tell you all about. Maybe there will be questions. One other thing actually though, maybe just to highlight, is that sort of the 2 tiers of service, and you see that sort of in the middle of this slide, the MySSP offerings of the immediate support through their call center, right, which we sort of put out there as almost like a walk-in clinic, like a call-in or a text-in crisis clinic. And then there's ongoing support. So if you have a student for whatever reason who can't access ongoing care, there is ongoing care through MySSP, which we actually thought that MySSP was going to lose money on us and our students by offering ongoing care. And they haven't told us that they've lost money, but it's working out well for us. I also did want to highlight before I end that we brought this on. We decided to do this pre-COVID, right? Remember that world pre-COVID? We decided to do this, and we were thrilled with our rollout. I will tell you that it has been a godsend during COVID, because certainly our international students, but also our domestic students, and our domestic students who are far flung now have been accessing MySSP. And again, just because we're a small clinic, we're open during the semesters. We're not open during the summer. We're not open, we're Monday through Friday, 9 to 5. So the fact that MySSP is 24/7, 365, regardless of where you are in the country or in the world, has really been a godsend for us. And the clinical support, the clinical and the logistical support has been amazing. So, and I really am not just saying that. So anyway, I don't know if I have another slide. That's just the one, right? I just had the one, right? Okay.
Yep. So I just wanted to involve all of our attendees in a discussion. Obviously, none of these current events are new to anyone, but we just wanted to highlight, obviously, through the pandemic and with COVID-19 hitting individuals and families and institutions so severely. I'm sure you're all familiar with the Active Minds and Healthy Minds Network and ACHA survey results. But basically, students are more challenged than ever with their mental health, considering being stuck in the house or being challenged to do their schoolwork. And in some cases, students have experienced race-based discrimination because of COVID. Another challenge that's specific and unique to international students as a result of really the world shutting down is that a lot of the USCIS offices remain closed, and so students are not able to get visas even if there is an ability to come to campus and to study in the United States. They literally just can't get their interviews or their visas processed to make that happen. Another thing that's worth pointing out is that obviously in the States, and it's really echoed across the world, there have been, just resounding support for Black Lives Matter and, and really just a disgust around the police killings of Black people. And of course, that has impacted mental health. It's impacted it's impacted Black Americans, but we also have a lot of international students who are Black as well, and no one would know that they're international students, so they could be experiencing an increase in xenophobia and racism just the same way Black Americans could. And then lastly, of course, it's just been a roller coaster with the ICE and the current administration policy really just banning international students if classes were not available in person on campus. Of course, we also have the Harvard and MIT lawsuit that included another, I think, 57 or so institutions to fight that. And then, of course, the success of that lawsuit and the policy, being rescinded. So there's just a lot that has been put on international students. It just, like I said, an emotional roller coaster of, am I welcome? Should I stay? Should I go? But one of the pieces that I thought was really chilling it was an opinion piece on a blog that came from a couple of international students that were basically saying that they're more than a paycheck. They don't feel like, the lawsuits really spoke to their value of culture and the knowledge and the community that they bring to campus, but really that, they feel some challenges just around being such an integral part of the American academic system, financial stability. So I just wanted to kind of put these points out here, and I invite the other speakers to join me in kind of touching on these topics, but more than anything, we really want to invite our attendees to share your experiences, things that you've heard from your students, things that you're working with your administrations and your colleagues to address, and some of the other just concerns that that you're hearing about your international students and how that impacts mental health.
Thanks, Colleen, and thank you so much to Nancy, Dina, and Ivan as well for all of that presentation. I have been floating around in the cybersphere, getting your questions and trying to organize everything. So we do, as I put in the chat, we do want to save a good portion of our conversation in this audience Q&A around the current events issues, and we want to hear from your experiences. While we are waiting for you to submit those questions, I'm going to loop backwards on some of the questions about the study, about MySSP, about Jed Campus. And I did want to start with the study in terms of how many students, total students, are represented in the data. That was a constant question in the chat. So Nancy or Ivan, if you could speak to the total number of students, that would be great. In addition to that, do you also have data or info on utilization rates for students who presented as high risk, things like non-suicidal self-injury and suicidal ideation? Was that represented in any of the data that didn't necessarily make it into these slides?
That's all you, Ivan.
Okay. Colleen, you just asked me the question 3 days ago. What was it again?
So I can answer that question because Ivan just provided me with the data. So we had 23 American institutions that participated And at those institutions, there are varying numbers of international students. So the study basically ended up surveying just over 500 students. Many of those students were multiple users, but we did have at least 500 unique users whose data we collected. Could you remind me, Kyle, again about that second question? And either Ivan or I could address it. Oh, I remember. It was about the crisis statistics. So yeah, it didn't make it into the slides, but we certainly invite you to download the study. I don't remember exactly the study notes, but I can tell you across the board with MySSP, depending on the institution and the population size of international students or even just general student body, we tend to see anywhere between 2% and 10% of the interventions that we have with students, show as crisis, where we would be engaging with the institution to relay their campus crisis protocols and to get students to safety, whether it's through a campus personnel or through local first responders when it's appropriate.
Yeah, and what I can add to that is then we screen people. So when they're in a crisis, we're not going to ask them silly questions. So the protocols are starting, and we're not going to ask them, how concerned are you about the presenting issue? We just start the protocol, and people, if necessary, well, Colleen and Dina are more aware of what the protocol exactly is. But we just start doing the protocol, and then we're not going to bother them with survey questions. So they didn't end up in the data because so they're more or less screened out of the study. If it would be like an official study, we just start doing the protocol, and that's more important than some survey that we want to do.
Of course.
I actually had a question for Dina, and that is, do you have the data on the percentage of domestic students versus international students that utilized the app at Sarah Lawrence, or if Morneau Shepell has that data nationally?
Yeah, so I don't have that at my fingertips. I know that Morneau Shepell does have it nationally. I think that our international student population at Sarah Lawrence is about between 12 and 15% of our student body. So again, we would expect it to be about that. And I think just because I review the data all the time, I think that we're right in there, if that helps.
And I can just add to that, the data that we're able to provide institutions would be the utilization of language. So we will show you, and you can access it 24/7, what language your students are accessing the services. We'll also show you students' home countries as well, so that you have both a suite of information about students using it in language and just generally international students who are using the service, whether in language or in English.
Thanks, Colleen and all. And specifically, as it pertains to the study, what is maybe even just like a ballpark breakdown in terms of countries of origin for the purposes of the study? And related to that, has that now informed potentially future language offerings for the platform as you expand MySSP?
Yeah, that's actually an excellent question. I don't have in my memory or in front of me a list of countries that the students identified with. So that's something that we could follow up with if the person wants to reach out to ssp@morneaushepell.com. But as far as the languages, what we actually found from the study is that Korean and Arabic are utilized really like infrequently for in the moment or crisis services. So what we've actually done is shifted our investment from those 24/7 crisis counselors in Arabic and Korean to the ability to add even more languages in ongoing support. So we did identify during the study some home countries and some primary languages of students that we wanted to be able to support in an ongoing capacity. So all of those Arabic students could contact us for scheduling an appointment out and working with a clinician who meets their language or their cultural need. So that is an excellent question. I appreciate that. Thank you.
Yeah, I looked it up quickly, and so actually most people actually use English as the language for communication. So in that sense, language in itself is is a bit of a limited indicator. And then the other one was Korean and Arabic, and then we had a slightly very small amount of French actually, but because some people still
Chinese as
decide
well, I know.
to keep it in English, it might not be the best. That's why we had this discussion, and language in itself might not be the best indicator of our services, where the cultural appropriateness is probably just as important, maybe more important. Of course, I'm biased. I'm Dutch, so when I came to Canada, North American habits are not as normal as you guys think they are. So I think cultural appropriateness is very important.
Thanks, Ivan. Okay, so I'm actually going to switch gears. We can come back to a couple of the MySSP app questions. And Dina, maybe the best place to start is with you. Plainly and simply, what have you found to be the most effective ways to reach international students in your experience? Through the app, but also in other ways in terms of the orientation, other outreach opportunities. What have been those effective strategies? And especially now during COVID, what does that look like?
So a couple of things. So we made a decision years ago, and actually, for those of you that don't know, Nancy was my boss for many, many, many years at Sarah Lawrence, and we worked together. And while we worked together, we made a decision that it was very important to make sure that we had clinicians that were multicultural, right? That either came from or trained in other countries, or had different backgrounds, different perspectives. And so even though we're a relatively small staff, we actually have one of my psychologists lived in India and went to college in India until she came here to the States for her graduate degree. We have another clinician who was born and raised in the Caribbean and then came here for graduate school. Nancy, when she hired me, hired a wonderful clinician from Australia, who has left, but from Australia. And so that's sort of a long way of saying that some of it is who we hire, right? And to really make a commitment to making sure that you have clinicians that reflect your commitment. Along with that, we work very closely with Sarah Lawrence's international programs, international students and international programs work very closely with both of those offices. We attend their orientations, but then we also offer, one of the things that we've decided to do that we've had some success with is to do sort of much more of an informal come together for chats. So international student chats. We also push in, so we've got international student groups on campus, and we work by attending their meetings, right? Rather than just continuing to invite them into the Health and Wellness Center, we push in, and we have good relationships with those groups. And so we show up there and we bring cookies, and we bring cookies and lemonade or cookies and hot cocoa. And we have the conversations more than anything so that we are a friendly and hopefully, familiar and friendly face and name, so that trying to reduce the barriers and reduce the stigma. And so with all of that, we're now sort of bringing the MySSP product with us when we go in, and we talk to them in general, right, about acculturation issues and what it is to be a student at Sarah Lawrence and what it is to be an international student at Sarah Lawrence. And then we also say, hey, have you guys downloaded MySSP? Now, most of them, because we've been doing this for a little while, most of them have. But if they haven't, we walk them through downloading it. We talk to them about how to use it. We talk to them about the content. And sometimes we actually, when we have a student in the office, we will walk them through how to use MySSP. So I'm not sure if we sort of, I guess we sort of use every technique we can think of. And if people that are listening have other techniques, please feel free, because international students still remain a difficult cohort to access, at least for us, much more difficult than domestic students.
I will just add to that. I know that just from our experience implementing MySSP for international students specifically, we tend to see a greater engagement level and higher utilization numbers when we market the service as a general student support program as opposed to a mental health student support program because of that stigma. So when international students hear mental health, they're less likely to utilize it, but positioning it as like having a bad day, give us a call. And so that when students do engage with the app and engage with the service, we're always inviting them back. So it's really, lowering barriers as much as possible.
Okay, so we have a lot of questions. I think we have room for one more. And again, I like to ask these questions kind of in two parts, so I'll do my best to make this clear. One, we have a lot of comments about not only cross-state licensure for clinicians, but now we're talking about clinicians speaking to students outside of the United States. So could you please talk a little bit about how cross-state licensure and I guess cross-national licensure works for MySSP? And then secondly, how do you vet the clinicians? And specifically with this question, what is the liability risk to the institution? How do you protect from risk with the clinicians that are on the platform? So that might be the last question.
Okay, so I'll unpack the first of the questions. So Morneau Shepell has been around for over 50 years. We've been offering counseling since 1974 and mental health support to institutions even before we offered MySSP. So we have an enormous network. The bread and butter of our business is actually EAP. So for employees and their families, we're providing support in that light. And so we've built a global network of over 35 clinicians across the states and across the globe. I think right now we have something like 18,000 clinicians here in the United States, and that spans all 50 states. But we do have clinicians in over 160 countries. So that is what allows us to work with students in an ongoing capacity in state, in territory, or in country. I will say for that in the moment, real time crisis support, we do operate much the same way that the Suicide Lifeline operates, in that we treat all of those chats and calls 24/7, 365 in the moment as a crisis. And so we're able to kind of operate where students are contacting our clinicians in our care access centers. But for ongoing support, when we are pairing a student with a clinician, we're doing so in state, in territory, and country almost all of the time. I say almost all of the time because in some cases, because we're not actually a mental health company and we're not required to abide by some of the same jurisdictional, licensing rules or limitations that campus counseling centers are, we do have the ability to kind of supersede cultural support or language support with, the nearest available match. And a good example of this could be, if you have a Brazilian student who is studying in Arkansas who's requested Portuguese, I would, I'd put a lot of money down to say that we had, a Portuguese-speaking clinician in Arkansas. I don't know, that we may, but in that case, we would kind of supersede the licensing requirement to make that cultural match for students. The second question, and I invite you, if you have additional questions on that, I invite you to reach out to us. You can visit myssp.app or ssp@mornowshepell.com. The second question around liability is that basically this is a partnership, and so it's really around us taking on some of that liability and the institution also taking on some of that liability. And so we work with institutions, and that's covered in our contract agreement, the terms and conditions with institutions. And I would invite you all to reach out again, and happy to share this with you. But we certainly want to do our best to take care of students and to partner with institutions to kind of get around some of the challenges that you all are having with your students who are international or even out-of-state students.
If I could just add really quickly that those were excellent questions and questions that we had. And I don't have time, and I'm not going to dive into how we came with Morneau Shepell to the answers to those questions. But we spent a lot of time figuring that out, and it's working well. But we had our lawyers go through everything. They wouldn't let me sign anything without them going through everything really carefully.
Thanks, Dina.
Okay, great. Well, I think that is all the time that we have for today. So I know that there are a lot of questions about cost and the different tiers and other questions about the platform. So you have the contact information there. And what I will just say is thank you so much to Colleen, Nancy, Dina, and Ivan for joining us. This is, part of Jed's comprehensive approach and connectedness and very intentional about reaching every single student on campus through every pocket of campus, not just the counseling and health center, but a campus-wide approach to protect the emotional well-being of students. And with all these things, we consider these to be promising practices, and we invite you to always look and vet and review things from your own institution's lens, because we know that every single school and college and university is different and unique and has unique needs. So please continue your conversations with us, and thank you for sticking with us this Wednesday. And we will talk to you soon.
Thanks, Kyle.
Okay.
Goodbye. Thanks, everyone.
Have a great one, everyone.
Thanks,
Bye-bye.
Sarah, everyone, for joining.